Hello, everyone. This is Dr. Melanie Gray with another episode of Code Calm, the podcast that gives you tools to live healthy and live well, navigating the stress of our lives. It is my great pleasure today to have as my guest Basia Perez, a healthcare advisor who focuses on burnout, workplace culture, and leadership within healthcare organizations. She works with teams and leaders to address systemic issues that contribute to burnout, high turnover, and declining morale in healthcare environments. She's passionate about challenging unhealthy norms in the healthcare industry. And so I'm so excited to have her as my guest today. Basha, welcome to Code Calm.
Thank you, thank you, thank you. It's great to be here.
So tell the audience how your journey into this path of work.
Yes, thank you. So the journey into this path of work, it began actually at McDonald's. I was a 15-year-old kid and I needed a job, and that was my first job. I took anything that anybody would give me. So I ended up at McDonald's. I worked there for 4 years. And one afternoon, a dentist came in with his family, and I feel like he was maybe mocking me a little bit, but he was asking me questions like, do you really like working here and why? And all these questions. And I believe that I must have sparked my personality, my answers sparked an interest in him. A couple days later, I got the job at the dental office. I was 17 years old at this time, not even graduated high school, but I was ready to learn. I was intrigued. Okay, well, at first I was a little bit grossed out, right? Teeth, it's not for everyone, but I also love a good challenge. I love to learn. I love to be curious, ask all the questions. And so that led me into getting a dental assisting certificate. But then I wanted more. So I got my bachelor's degree. I went to get my master's degree. And because I love education, I love learning. But one thing that I found over the years of working in dental, I eventually left the dental field. I wanted to work in the hospital with my master's in healthcare management. And I saw that people aren't being listened to. We're talking and talking all day long, but no one's really listening or acting on the conversations that we're having. And that just never sat right with me. I had to change it. So that led me to beginning my own businesses, taking control over my life, and wanting to fight for people that weren't able to fight for themselves.
And I would say, I love that story, that healthcare workers, those of us who care for others, are some of the most unhealthy people.
Yes. Yeah, you're
Yeah,
right.
we struggle because of our stress, our high cortisol levels are up, and we're not sleeping, we're not eating as well as we should, we're not exercising, and we're not actually following our own prescriptions to others, which can be a reasonable stressor, right? When we're not
Definitely.
healthy, we're not exercising, and we're not taking care of ourselves. But you feel that the healthcare system can do better in
Definitely.
supporting their employees and teams in taking care of themselves. What would you suggest if for our listeners, would you have them advocate for themselves to engage their employers, these organizations, in conversations for creating healthier environments?
Great question. The first couple of things that I would recommend to everybody, that what I recommend to all of people, is first observe and communicate. I am huge on communication. It is so important. And it's not just, hey, I believe this is going wrong. It's consistently communicating, right? It's following through. It's asking questions. It's coming back to the same problem or same question that you had if it's not been answered. There's such a lack in communication or even feeling safe to be able to open up your mouth to others, right? Because you can just easily get shut down, or your boss is too busy, or there's just too many things going on, and it's easy to get discouraged to keep going on that communication. I want people to not stop, to not get discouraged, to keep going. If it's not working out with one person, go to another person. But you also have to have the mindset to know what you want and what you don't want, and being willing to talk about it openly. But also, on the other hand, the leaders, there needs to be a place that creates this safety, this ability to be open about things as well.
Well, there are a lot of KPIs, a lot of metrics
Yes.
that organizations have to meet to remain viable so that they can support the incomes of the people, of the leaders and all the members of the team. So there is a fine line. There is a balancing in communication and meeting the needs of the worker and the needs of the employee. But how do you then help employees navigate their daily stress? Communication is one thing, but sometimes the impact of that takes time. What can listeners do immediately to reduce their stress? Immediately to change their culture?
Immediately. One thing that is talked about often is self-care, right? I do believe in self-care to a point. I don't believe it works the way employees think it should work and employers believe that it should work, right? Because the problem at work isn't the fact that people don't do the self-care at home, it's the workload that shows up at the job. So creating boundaries, safe boundaries, firm boundaries within your organization, you can immediately do that. If there's not enough time to provide proper care for a patient, there needs to be a boundary placed so you can finish a task correctly. Because if these boundaries are going to keep getting pushed and more work is being put on the employee, where is that going to go? It's really not going to go anywhere. It's only going to create more chaos, more burnout, and all these things. So I would say one thing immediately people can do is start placing boundaries and being consistent with what they do with them.
Well, I don't know how to place boundaries, Basha. I want to give my best, but what do you mean by boundaries? Is
Yeah.
anyone staying over to 16-hour days?
You have to learn to get comfortable. And this is also working within yourself, right? You have to learn to get comfortable with saying no. And it's not saying no to providing patient care or saying, no, I don't want to do this job. It's getting comfortable saying no, that this isn't sustainable. This isn't going to get the job done. And it seems really, Melanie, it's very simple, but so hard for people to do. You can say no to something at that moment that's an immediate action. It's a firm boundary and it provides safety for your own mental health and for the health and patient safety, really, as well.
Oh, no is a full sentence.
It can be. I mean, there's a lot more that goes into it, right? It just depends on the situation, the thing that is going on. Generally speaking, ever you are placing a firm boundary by using the word no or asking for help or saying this is too much at this moment, what could I do right now? I mean, I'm not saying use the word no and move on with your life, right? The word no in for me can come in so many different ways, right? I need help with this. This isn't going to work for me. No. No, I can't complete this right now. Could I wait for later? Stuff like that.
Well, I'm a leader. I might not know if I'm pushing my team too hard or if I'm not setting good boundaries. What are some signs for me that I might need to be aware of so that I can better support my team?
Yeah. I think as a leader, it's important to be able to step back and truly observe your people, right? To get to know your people. If you know Basha is good at doing all of these things, but she's starting to get sloppy and things are not starting to add up or hours aren't matching up, et cetera, you observe and you see your people. As a leader, it's important to not I understand the importance of metrics, of making money. I'm all about profit. I'm all about making money, but there's a way to go about it. There's a human way to go about it. And if you know your people, how to pronounce their names, for example, what they do at home, how many children they have, what do they do on a day-to-day basis? What does their workload look like? You can see when it starts to be a little bit chaotic or where people can breathe, right? If people are running around or upset, I mean, it's really reading the room. It's being emotionally intelligent, right? Who you've hired to be a part of your team.
Well, there's so much virtual work as well.
True.
How do these tactics, what observations would you give a leader who has a large virtual team?
Great question. That's a good one. That you would see in the work itself, right? If things are not being met, if people aren't completing what was supposed to be done, if hours are being extended, if people are working outside of their hours, that you can just try to visualize, right? With what you see virtually. But there's also this important thing about asking a person, hey, how did today go? Can you tell me what is working for you and what isn't working? It truly is as simple as that, is asking the person, how can I support you to make this more profitable for all of us, right? How can we make more money? Because when people work better, when people feel supported, when people feel heard, they will work harder. The money follows that kind of idea.
Maybe we have a listener who needs to learn how to set boundaries. Perhaps they need to set boundaries for themselves. The pressure is not coming externally from their leader, but they have placed upon themselves unwritten expectations. How do you help that person set boundaries as well?
Gosh, that was me for so many years, and it was tough because I love to please, I love to serve, I love a good pat on the back, good job, Basha, you did it again. But still, at the end of the day, at the end of the week, I was still upset and I was still overwhelmed and burnt out really from all the work I was doing. So that for an immediate, I don't have an answer for someone to immediately change that kind of internal boundary placing, but over time you could do it. It's mindset, right? You have to first realize internally what is going on inside of me. Why do I feel this way? What do I not want? How do I not want to feel? Do I really love this work? Am I where I want to be? And then once you answer those questions for yourself internally, you move on with that. You take the next steps after that. If this isn't where you want to be, then you need to reevaluate your profession, right? If this is where you want to be, but you're feeling burnt out and you need to place boundaries within your own life, it's just answering your own questions, but starting off with what do I want and what do I not want?
Well, maybe I haven't spent enough time with myself because I've been working so many hours. I'm not quite sure what I want and what I don't want. How do I navigate that question?
You are good, Dr. Melanie, if you just don't have the time. In our day and age today, we are so quick to jump on our phones and scroll and
Oh,
media and going on all of those things, right? Being an adult, really showing up for yourself, making a decision to instead of scroll, do some journaling. You have to create the time for yourself. You can't just walk around in life and being upset that you don't have the time to get better if you're going to be scrolling Facebook and Instagram and talking on the phone for hours or giving your time to people that don't deserve it or don't grow you, right? You have to just say no to something. I mean, there's no really magic answer for this. If you're doing something that's not serving you, put a pause on it. And I'm not saying forever. I love to scroll too sometimes, but there are other pressing things. And if I am not satisfied with my life, if it's not going well and I don't know how to begin it, then just start with one thing. Instead of an hour of scrolling, do an hour of something else.
awesome. Well, Basha, tell the listeners how they can connect with you.
Yes, connect with me. I am on LinkedIn, like a lot of people. Just Basia Perez. We just opened up our Instagram. I sound so old saying it, I feel like we got in with the times, but it's RNB_Perez. It's our Perez family journey for our second business we've been opening up. And then yeah, those two are great places to find me.
Awesome. And as we
Yeah.
close, Basha, what is the code for calm that you'd like to leave the listeners as we close?
Yes, the code for calm, pause. I was always doing everything so quickly in my life. I mean, in my family, to basha something became a verb, right? Pause, breathe, and reflect. Give yourself that space, that time to work through whatever it is you need to work through.
Pause, breathe, and reflect. You have heard it from Basha Perez on Code Calm. Your code, pause, breathe, and reflect. Thank you so much, Basha. If this episode of Code Calm resonated with you, please like and share it with others. And remember to live healthy and live well. Thanks for listening to Code Calm and make it a great day.